You know, I've done this before.
Do you want me to share something else while you're getting it figured out?
Sure, you go right ahead.
Okay, so I was just sharing with my team recently that doTERRA has hygiene kits that you can purchase. And I'd like you to know that if you ever want to purchase something just to donate to a really good cause, they sell it for $25, a hygiene kit with a towel, shampoo and conditioner, deep blue rub, it has a Melaleuca roll-on, it has a toothbrush, it has toothpaste in it. And it's just such a nice little kit. And when you purchase it, you don't have to receive it and then give it somewhere. They make sure it goes to countries that need help, even in the US, places that are having catastrophes. And what you do is you purchase it and they make sure it gets sent somewhere. And I just think that's a really wonderful thing that the company does. If you happen to be somebody who's on the monthly order and you get 30% back because you've been ordering for a year, like I do, they also give you PV points for it. So you get 25 PV points while you are donating to a good cause and having the product get sent there. So I just would love for you to know that if you ever are not knowing what to order for a month and you just like to donate, just put hygiene in the search bar and it'll take you right to the hygiene kits. So I know a lot of you don't know that. Just one little thing I wanted to share. Hey, I think you got it to work there.
Okay, it's in my Google Drive and I have a link for everybody who wants the slides. So here it is. Just going to scroll right through it. Pain is such an interesting thing. And the only thing I can tell you about pain is that it is absolutely complex. And I also want to offer a disclaimer that any of this information here is for your benefit, I hope, and it is not intended ever to diagnose or treat or be any form of health care. If you're having pain, please talk to your healthcare provider to make sure you understand what it is and your healthcare provider can give you the help you need. I think it's useful to start with a working definition of whatever our topic is. And so this one is from a gentleman named Greg Lehman. I respect his research a lot. He's a physical therapist and a strength and conditioning coach, and I don't know what all he does. I think he's a chiropractor too, but he has done a lot of research on pain. And I have his information at the end in the reference part. He says that pain is a distressing experience associated with actual or perceived tissue damage and involving sensory, emotional, cognitive, and social components. So it is complex. It's not just you hurt yourself and you hurt. You know, you get injured and you have a pain. So what he said is that we should consider it as a biopsychosocial model. That's a big word. It's bio, our biology, our psycho, our psyche, and our social, our way of being in the world model. So what he says is that pain is often more than just physical damage. I'm sure all of you have injured yourself somehow, or maybe you've had surgery, and yes, pain can be an outcome, but often it is more than that. Pain is influenced by many aspects of ourselves and our lives, things that have happened to us in the past, things that we have endured currently, things that we think about, influences from family and friends who've had pain and other conditions. But do know that there is hope in this, that we have many, many options for influencing the outcome of pain, as well as developing reasonable strategies to help us recover from pain. And that's not to say pain will go away completely, but certainly we can diminish it. Pain is not all in your head. And I think this is a common thing that's thrown, especially at women. It's just in your head. No, it's not. Pain is real. And when you have pain, it hurts. Your brain and your spinal cord, however, can alter pain sensitivity and upregulate, which is an increase, or downregulate, which is a decrease, your sensitivity to pain. That means that some of us get really, really good at increasing our pain because our systems are on hyper drive, hyper alert to anything that would create that pain. But do know that your body is remarkably resilient, and your body also has an incredible ability to heal itself. Pain signaling is influenced by, again, the psychosocial model, physical things, certainly aging. If you've been injured, if you've had surgery, if you've been ill, if you experience loss of sleep, all of those things can put your pain signaling mechanisms on hyperdrive. In fact, a good friend of mine, when I was pregnant with my son, said, "Oh, how's your sleep?" And I told her it was not so good anymore. And she laughed. She said, "That's how they torture people, isn't it? Deprive them of sleep." So think about that.
So can I
The
make a comment?
emotional,
Can I make a
yes,
comment real
absolutely.
quick? So I have a daughter-in-law living with me who is super, super active and in shape, but she just had her third baby 6 months ago. And because of the situation, she hasn't been able to work out as she has liked. And over the last 2 days, she's had some sciatica pain, and it has frustrated her to all get out. And it's so interesting as I'm getting older that I think, oh, young people don't have any pain. They're just bopping around life, doing everything the way they want to do it. And I'm the one that's getting in pain and getting old and having these issues. And to see her go through this for the last couple of days has been very interesting. Somebody who's very in shape, not overweight, and just, really loves to, and to have her just be stretching and trying to deal with it. So it's interesting that you say loss of sleep, because this new baby has not been sleeping well at all. And she's really been struggling. And between that and not exercising like she's used to, maybe that has something to do with it.
It has a lot to do with it. There's been research in the last, I think, 10 years. One of the most fascinating things that was discovered about sleep, and it was a study that was being done on mice looking at something else altogether, is the discovery of something in the brain called a glymph system, GLYMPH, that is activated during deep sleep. And it's in that activation during deep sleep, literally, I think a simple way to explain it would be that your brain shuts down all muscle activity capability. You know how you have these crazy dreams where you're running away from something and you can't move? That's your brain in deep sleep. And during that deep sleep period, your brain literally power washes all the toxic, trashy stuff out of the tissues of your brain. So that system is activated during deep sleep. And if your deep sleep isn't happening, then you're going to suffer the consequences of that. And it's one of the things that's been seen, very classic, a hallmark symptom of Alzheimer's, dementia, depression, are people who have trouble with getting into deep sleep and staying there.
Interesting. Thank you.
It is very interesting, sure. So now you know about the glymph system in your brain.
Got it down. She'll probably already know about it, but I'll mention it to her.
Yeah. Yes. The next point about our biopsychosocial aspect is that we have an emotional part of pain signaling, which can involve fear. And lots of people do something called catastrophizing, making things worse than they could possibly be in a lot of instances. And also something called kinesiophobia, which means fear of moving, that we inhibit places that are painful for us. And so we end up with lots of adaptations in our movement. Anxiety, duress or distress as opposed to regular stress, something that really presses down on you. Depression, isolation, frustration, anger, and grief all can influence your pain signaling. Pain hurts worse when you're in those types of stages. Also, we've seen, especially this last year with isolation due to COVID, that people miss being in the work environment. They miss the interaction with their peers. There's lots of studies being done this last year on isolation, which is different from just wanting to be alone. But being lonely and isolated are real drivers of pain signaling. And also the sense of not having anyone to support you can be very uncomfortable. any lifestyle changes too. If you're not active, you smoke, you have poor nutrition, you drink more than you need to, all of those things can also influence pain, because drinking, for example, shifts your entire neural system. And then the mental aspect of pain signaling would include belief systems and thought processes, which may or may not be correct. I had a great teacher years ago who said many people are very strong about their beliefs and are very sincere about their beliefs, but they can be sincerely wrong. Mm-hmm. So keep that in mind too. I tell people when they explain to me that they're having pain that it's important to listen to and evaluate your pain, because lots of times we will go to a doctor and say, I'm having pain here or there, and the doctor in all good conscience will say, don't move it. But we know that motion is lotion. We are meant to move, and when we don't move, we can end up in worse trouble than we think we're already in. So listen as you evaluate your pain, determine if it's a brand new pain, or is it a different type of pain that you've been having? Maybe your pain someplace has shifted. Maybe it's moved. Maybe it's gotten stronger or lighter. Maybe it's changed from being a burning type pain to being more like a knife-like pain. It could be anything. It could be anything. But remember that pain does not always mean that you are damaged. In fact, often we have a pain stimulus. For example, if you break a finger or sprain an ankle, it's going to hurt. But after those places have healed and there's no reason for pain to persist, sometimes it does. And also remember that it's important to find a balance of what you can do when you have persistent pain while you avoid harming yourself. So the adage of no pain, no gain, for example, in exercise, I think is one of the worst sayings ever. You can do a lot of harm through trying to push yourself through pain, but pain may be a signal just to be cautious. And finally, any diagnosis that you receive does not dictate a destiny for you. Doctors are wrong all the time. How many people do you know have been told you have 3 months to live, and 6 years later, that person is still alive and doing pretty well?
Becky,
the other important, yes.
It's interesting that you said that doctors will tell you not to use whatever you've injured. They have changed to some extent. I've had a bad knee since I was 16. Somebody skied into it while I was standing at the bottom of the ski run.
Oh, nice.
So I wasn't able to ski, and I got hurt, and it wasn't because of skiing. And it gave me fits off and on for a long time. And then a few years after that, I walked into a dog crate with it and tore it up again. And this was 1974, I'm going to say. And the doctor put me in a cast, which is, to me now, is just crazy to put somebody in a cast and not let them use that joint at all. Now, if it bothers me, I have stretches and different movements that I can do that ease that discomfort. I'm not even going to say it's pain anymore. It's just discomfort. I can feel it. The muscles will tighten up around it and that kind of thing. So, those exercises were given to me by a doctor who sent me to a PT. So it's interesting that some of their views have changed as well.
Yes, and I think many doctors are getting wiser to the importance of being physically active even into older age, because physical activity changes every metabolic measurement for the better, whether it's cardiovascular, whether it's something in your gut, your joints, in anything you can imagine. Regular, moderate intensity physical activity improves every metabolic measure, period. there was a study that I think was released in 1988 that was published in the Journal of the American Medical Association. To me, it was a landmark study. It was done by Kenneth Cooper out of the Aerobics Institute that he has in Dallas, that looked at thousands and thousands of their own clientele. And any physical activity done regularly over time reduced all-cause mortality. That means people who were physically active had less risk of dying. I mean, we're all going to die someday, but it affects, yeah, quality of life and quantity of life.
Awesome.
So, like I said, motion is lotion, one of the best little things to remember that I heard from somebody. So, all that said, your diagnosis is not your destiny. Do find the things that are right with you. It's so hard when you go to a doctor and they're looking for the things that are wrong with you. And as physically active as I've tried to be my whole life, I very rarely have a doctor that says to me, good for you, look at what you're doing. You're 70 years old and you walk in here. I just had my 3rd year post-op evaluation for my 2nd hip replacement. And I handed them my sheet that at the very top listed all the ways that I'm physically active. And then, you know, I said the things I'm concerned about, and right away he started going, oh, you've got neuropathy in your feet and you need to see a pelvic floor specialist. And then he went back to my list of things that I'm doing. He said, oh my goodness, you ride a bike with a 12-pound weight vest on? Why do you do that? Because it challenges my cardiovascular system, and I want to make sure that my osteoporosis doesn't advance, and I'm having a hard time walking on my feet because my feet hurt. Well, it's not neuropathy. Neuropathy, I understand what that is, and I don't have neuropathy. So anyway, all that said, they don't know everything. But what Greg Legman said is, do find the things that are right with you based on the thought that you are an ecosystem, and your ecosystem is influenced by many, many factors all day long, every day. And keep in mind that from the Feldenkrais model, Feldenkrais, not Christ,
Got it.
Christ, yeah, we are dynamic, potentiated, and individuated. That means that every one of you whose beautiful faces I'm seeing is an individual that has come to this moment with your own history of everything that has happened to you from the second you were conceived until right now. So that is you, highly individuated. We are capable of self-regulating. That means that we can decide to engage in something or not to engage in something, or maybe make that little push, or to examine exactly what is that pain. We are self-organizing, which means, okay, my foot hurts. What am I doing to compensate for that? Because I still want to be able to get through my day. We are self-actualizing. That means we figure out our own way to get through the world within our social circles, our families, and whatever. And it reminds me of my daughter when she was about 2 years old. She would say, you're not the boss of me. I can do it myself. And literally, if you think of yourself that way, you really are the boss of yourself. And you have to be very careful at the voices in authority that you choose to listen to and decide what you're going to do about it. I'm not saying to ignore them or to try to move on with your life and do everything by yourself. We all need each other, and we need professionals who can give us some good information. Keep in mind that your ecosystem is also highly variable, and the older we get, the more variety we need. It stimulates our brains to do multiple things in different, maybe the same thing in a different way, or multiple things. And our brains change a lot when we devote ourselves to learning new things. Every day, week to week, month to month, and year to year, our sensitivities shift. And pain is the alarm in your ecosystem. It doesn't mean always that you've hurt yourself. It's a warning signal. For example, if the smoke alarm in my house went off right now, it doesn't tell me if there's a fire. It doesn't tell me what kind of smoke it is. It doesn't tell me how much smoke it is. It doesn't tell me where the smoke is coming from. It's just telling me I have smoke. So going back to that thought about listening to your pain and interpreting what it means to you and doing reasonable things about it is very important. One of the things that you can do is to turn down the amplitude of your pain signaling mechanisms by changing your story. Remember that you are inherently strong and stable. You are not weak and frail. Maybe you have received a diagnosis of X, Y, and Z. I remember sitting in a doctor whose name I hear as a regular advertiser on the NPR station here, KUT. Her office was filled with supplements, and she sat and literally threatened me, if you don't start taking these supplements and getting on this particular drug, you will fall and have a hip fracture and die. And I'm sitting there looking at her thinking, I'm still in my 60s, and you're telling me, as physically active as I am, that I'm going to fall, fracture, and die. I'll see you later. Yep. You are adaptable. Oh, for example, we do many physical things that stress us not to our maximum. And the example that Lehman gave is the average spine can withstand more than 2,000 pounds of pressure and handle more bending and stress than we realize. There are many studies on what makes a disc rupture, what causes a vertebrae to fracture, blah, blah, blah. And in healthy, normal spines, it takes quite a lot. In fact, one of my favorite books that mentions Feldenkrais method is an excellent way to help relieve low back pain beyond surgery. She's talking in the first half of the book about surgery on the spine and how strong our spines are made and put together, and the amount of literal physical force it takes to disrupt a spine to do these interventions of spinal fusions or baskets or whatever else. So it's very interesting. In fact, there's a lot of research that shows that even though pain in your spine is intense, it can often self-resolve in 3 to 6 months if you give it time.
Wow.
If you can stand it for that long, yeah, it can be very intense. But you are adaptable and you can change as long as you aren't dead. You are a living organism, and I go right back to this. You're an ecosystem that's dynamic, potentiated, and individuated. You have lots of, what do I want to say? I remember watching an anatomy video of a man who said redundancy is the thing I'm thinking of. You have a lot of redundancy. You have these nerves that come out of your neck, that come into your shoulder, that come together and separate and come together. And he did that several times with his fingers. And I'm thinking, wow, that's pretty amazing to consider that you have redundancy in your system. Mm-hmm. You think about an ankle sprain and you tear those little ligaments around the outside of your ankle, but you're still able to walk. It may not be pretty and your injury may be ugly over time, but you can still get through your day if you need to. And remember that change happens, and we as individuals hate change because we don't know what the outcome will be for often for many of us. And change involves adaptation. And please, if I would tell you to keep in mind anything besides motion is lotion tonight, adaptation is a process, and every process takes time. So give yourself time and space and grace. And here's the nice thing about doTERRA. We know the potential of these oils to improve our ecosystems as well as modulate the amplitudes of our brains. My story, how I got into this, I thought, yeah, this friend of mine sent me an invitation. I went to her house. Somebody put a roller mix of frankincense and breathe on my palm, and I went, oh my gosh, what is this? I gotta have this. It was so great. It was such a beautiful combination of aromas. So that's how I got in. I signed up that night right there. I want more of that. But two other things that we do have, one was mentioned last week, which is the aroma touch technique. And there's the website for it, and then Symphony of the Cells, which are sweet melody knows a lot about and she's presented on before, but you can go to Symphony of the Cells website and learn some more about that. So here's my references, and I would love to know, oh, by the way, this Lorimer Mosley is an internationally recognized researcher in pain. And this little 15-minute TED Talk he gives is hilarious as well as insightful. So I definitely recommend that. Greg Lehman's book is available for free online. And I pulled a lot of information out of that. He does have a lot of redundancy in there because he wrote it for individuals, for professionals, and basically says the same thing over and over. So here is what Greg says, a little synopsis, and you'll probably get some more out of that than I did. And I do have a link to this. I sent it to Shalene, and she was not able to get into the Google Drive file that I created for that, but I'll put it in the chat.
That's a good idea.
Yeah, I want to hear your oil stories too. What gives you relief from pain? Share.
Frankincense, marjoram, and wintergreen and deep blue rub. Those are my go-tos, as well as past tense.
Do you blend them? Do you layer them? Do you mix them with fractionated coconut oil? How do you use them? Do you take them internally?
I do frankincense every morning, 2 drops under my tongue. And when I have back pain, I layer the frankincense, marjoram. You can throw lemongrass in there. I don't do that because I have a skin sensitivity to lemongrass. So I take lemongrass internally and wintergreen, and then I get it all deep in by using deep blue rub over the top of that. And then the past tense, when I have head tension, I use the past tense on my temples, top of my head, over my sinuses, the back of my neck, behind my ears. It's great. It really helps. I also use deep blue on my shoulders, then the rub, because it does help my shoulders to relax.
Who else? Thank you, Lee.
I developed a blend for my husband, and I did put frankincense and marjoram in it, along with deep blue, Roman chamomile, cinnamon, and a couple of more things I can't remember. I think juniper. And yeah, I don't have the patience for that whole layering routine. I just throw it in there like the kitchen sink and slather it on, and it's like, there, it's on. Do something.
And does it help him?
But he says it helps.
That's awesome. That is awesome.
Yes, he says it's very effective.
So Becky, what does motion is lotion really mean? I mean, you've said is that just because I think of a car needing oil? Is that kind of what that means?
Yes. If you didn't have oil in your engine, it would stop working. And all of our movable joints have a tissue around them called a synovium. It's part of the joint capsule that surrounds every movable joint in your body. And part of the work of the synovium is to secrete synovial fluid, which is increased in production as soon as you begin moving. It's probably one of the reasons why people feel stiff when they wake up in the morning. And once you start giving yourself some gentle movement, wherever that is, you'll find that your discomfort lessens, your stiffness for most people tends to diminish. It's that synovial fluid that is being secreted from the synovial tissue into the joint and getting warmed. As it gets warm, it thins, and it helps the movement of the joint become smoother.
So I don't have a problem when I wake up in the morning, but when I sit here at my desk for 2 hours and I'm like, oh my goodness, I haven't moved in 2 hours, and I stand up, I'm like, and then it works its way out, and I come and I sit for 2 more hours, and then so it's mostly my knees. But is that what you're talking about?
Yes, exactly.
Okay.
And some of the things that have been workarounds for children in school, for example, are stability balls, the round shape of the ball creates a instability for them, and they have to move all the time. There are some seats that have been developed that are on like a gyroscopic device that as you sit, you can tilt in any direction. There's lots of Feldenkrais things that you can do sitting that create mobility without having to get you up out of your chair to move around to do that. So just, wiggling. In fact, I heard this at a aging and exercise seminar years ago, that people who jiggle, people who cross their leg and their foot goes like this, people who are very jiggly and active burn up to 300 more calories a day than people who don't.
Oh, that's very interesting.
So jiggle.
I'm going to look into that. Is it called an instability ball or a stability ball?
Stability ball or a Swiss ball. Yeah, stability ball.
I've seen that.
Make sure you have it blown up so that it's pretty firm, because you can squish down into it and it's not the same kind of thing that you want. Yeah.
Love it. I had one other question for you. You mentioned a 12-pound vest while you're biking. I think of biking as just the legs doing the work. Why would wearing a 12-pound vest change your workout on a bike?
In gravity, because I'm upright in gravity, it applies extra weight into my spine, a compressive weight. So it helps to stimulate bone growth. As we get older and our muscles begin to diminish in volume, that means that there's less muscle pulling on bone, which is why women end up with more muscle loss than men. It's called sarcopenia. And because there's less muscle mass pulling against the bones, and we begin to develop osteopenia, which can go into osteoporosis. Mm-hmm. So the compressive force of that 12-pound weight vest through my shoulders into my spine and ribs, I'm hoping will help slow down that process for me. Because I'm a very tall Caucasian female, I am more at risk for osteoporosis and sarcopenia than somebody who's shorter and stockier, like my little sister, who will never have this problem. She and I don't look alike. She thought she was adopted for a long time, but she is not a tall, thin person. She's shorter and stockier.
Yeah, I know how that feels. All right. Any other comments or things that you use for paying people?
Or just to shift your mood, or to give you an emotional change, or to brighten your day. I mean, there's a lot of stuff that assaults us.
Okay, I misspelled that, but I put in the chat that a couple of good doTERRA supplements for lubricating our joints are the Z omegas. Your omega fatty acids are really good for lubrication. And sometimes we just think of them for the brain, but they're not just for our brain or our heart. They are for our whole body. And the deep blue polyphenol compound is another one that's really, it's good for pain, and it's good for lubricating your joints.
Need to try that. Love it. Any other questions or comments? Oh, Becky, thank you so much. I love
I hope it was useful.
It was wonderful.
Thank you for inviting me.
I just know that you know so much, and I appreciate the way you can teach us and help us. So yeah, thank you so much.
Sure, it's been a pleasure.
Next week, Rhonda's going to be teaching her first class ever, and she's doing a basic 101. Please don't stay away if you think you know everything about the oils. Every time I go to a basic 101 class, I learn something. It is amazing how the discussion we have helps us all learn things. However, she has had major help with Digest Zen and stomach issues. So even though she's doing a basic class, she's going to be talking a lot about Digest Zen and stomach issues. So that's next week. And those who want to stay on for our little business section, feel free to stay on. Thanks for coming tonight. And we'll hope to see you next Tuesday night as well.
Thank you so much.
You bet. Thanks again, Becky.
Okay. Are we ready?
Yeah, that was great information.
That sure was. It was wonderful. She's so good. She teaches so well.
Oh, and she knows so much. It's so
yes,
awesome.
she does.
Well, Glenda, it looks like you've had stuff going on. Are you wanting to unmute and tell us what's going on with you? And if not, that's okay, but I'm sure curious. You're still muted. There should be a little button on the bottom left, maybe?
Oh,
There it is.
there we go. Okay. Can you hear me now then?
Yeah, what's up?
Okay. Well, I had some pre-cancer spots on my face
Yeah,
and the doctor gave me medicine to put on it and it's just made me red and sore and hot and burning. And so hopefully
so
it's gonna get
sorry.
well soon.
Correct X.
Have you gotten Correct X yet in any of your orders?
I don't think so. It doesn't sound familiar.
Do you have one handy, Lee? Mine's
I do.
downstairs. It's tiny tube. I think of it as doTERRA's antibiotic ointment, but because it's made with helichrysum, frankincense, lavender, melaleuca, and one more. Can't remember.
Cedarwood.
Cedarwood. It has amazing help. Now, I know Laura just said something before we started the class. She said, I get a lot of these anecdotal things that you talk about. And I'm sorry because I'm not a nurse. And so a lot of my things sound like, well, it's anecdotal. It's like I heard somebody had a problem and I had this and it worked. But this nurse friend of mine has a friend who had cancer spots on his face. The doctor gave him a prescription and the medicine, I can't remember. I've told the story.
Seems like it was
Yeah, it was hundreds of dollars.
$1,400 or something.
It was a ridiculous amount of money. And I remember, and she said that he said, I cannot afford that. And he did not fill the prescription. And she gave him 2 tubes of Correct X, which cost, I think they're $12 each.
$12 each. Yep.
Gave him 2 tubes of Correct X. And when he went a week later to see the doctor wanted to know what he'd been doing. So, yeah, put that on
I
your
think-
next order. And
I think it would help with the burning that you're experiencing too. I suspect that that's some kind of a chemotherapy drug.
yeah.
Yeah.
My husband, yeah, they gave my husband, when he had cancer, he'd been having treatments and they gave him an oral chemo drug and he burned inside and out. It was terrible. I'm glad your eyes look like they're okay.
Yeah.
Because Rich's eyelids, the bottom lids turned inside out. They look, yeah. And he had to have eye surgery. Yeah. Yeah.
They're swollen and sore, but
I bet it's very similar. And
Glenda, I know your order goes through at the end of the month. You can always hit process now, and you can always do a little bit faster shipping. So I would just go do that, put that in your cart and
I would too.
process now and get yourself some Correct X.
Correct X.
Yep.
Correct X.
And
Okay.
if you were nearby, I'd be dropping it on your doorstep, my friend. Oh, I'm so sorry.
Thank you.
Oh, and please keep me on the loop on how you do.
Yeah, mine was only 260 for a tiny tube. So
See what we mean?
yeah.
Well, I don't
Okay.
think, I would love to know if Correct X not only gives you some improvement, but it doesn't cause the problem as much too. So
Okay.
Oh,
Sounds good.
my
Thank you.
I'm
Appreciate
so glad
that.
you got on tonight. Feel free to get on anytime. We cover lots of good things.
Yeah, I appreciate that. I have been wanting to every single week, and every single week it's 8 o'clock and I'm like, oh gosh, I missed it. But tonight I told myself I was going to be here or else. So
I'm
Right.
so glad.
all right. Well,
So
thank
glad.
you.
Thanks for
Appreciate it.
joining us.
Hi,
Glenda.
Glenda. Thank you.
All right.
Okay, thank you.
And
Bye
Lee,
bye.
that was good to cover, but I bet you've got another message for us.
I have a short one and it's kind of about lists.
Great.
Here's a list for, oops. I guess I better share my screen.
Oh, I just realized I'm still recording, but I'm probably going to stop this too.
Okay, good idea.